They're cute as can be.
Yeah.
Adopt those babies.
Well, guess what? Would you ever do liposuction on your feet?
Well, how about anywhere? It's scary.
Oh, yeah.
Have you ever seen pictures of what it looks like
yes.
when you do that? I mean, you know, even if those of us who could use it still.
Yeah. Well, rumor has it that Kim Kardashian had liposuction done on her feet for the wedding, Karen.
This is the reverse of that, okay? You
Oh,
don't
it's
really
filler?
like feet. I know that it's, yeah. So this is filler to make them look, you don't have thin, bony feet that look all, you know, just thin and bony. This is Cara, beautiful. Okay, so she's a waitress. So she's on her feet. You know what that's like when you're waiting tables. Morning to night, it absolutely bangs up your feet. I think she's got beautiful feet. Cara, what would you like to see done to your feet and why?
Like I said, because I'm on my feet all the time, I just feel like it's starting to take their toll, and I just feel like, I don't know, they need to be a little bit prettier for flip-flop season.
All right, prettier for flip-flop season. So Doc's here. What are you going to do, Doc?
We're going to put a little bit of filler in this area, and you know, it's becoming the new essential for the summer. Patients want to have their feet looking great, and this is a really easy way to do it. If they like it and they really want to make it more permanent, we can always take a little bit of fat from somewhere and inject the fat into the feet. But today we're just using one of the fillers that we normally use in lips and creases and things like that, and it's totally reversible if they wouldn't like it, but it will make them look really nice.
Okay, I'm going to let you get started with your needle. Because you're eating breakfast, we're not going to show you that part, so I'm going to let you go ahead and get started. Let me show you a before and after picture of why some people would like to get their feet done, because sometimes your feet, especially women, we can have very thin, bony feet, and then you put a little bit of filler in, and it just gives them a fullness, and it, you know, takes away some of the years on that. Now, how does it feel, Cara?
Doesn't feel that bad.
She had it numb before. We showed you at the top of the hour she was having it numb. So right now we have the needle going in, and so it's pretty impressive. And you don't feel that?
It's just a little bit of pressure. No, not really.
All right, Doc, now how much do you put in, and how much is this going to cost me if I wanted to get something like this done?
It probably starts at about $300 and it can work its way up depending on how bony or how, you know, depressed those areas look. But, you know, in Cara's case, she really has beautiful feet to start with. We're just going to plump them up a little bit. But everything really has to do with when the patients come in. Some patients really have it going all the way back up to their ankles. So they really want to have the foot like from the ankle all the way to the toes really looking more plump. In this case, we're really just doing it right from the toe area. And it's kind of like what you would see in a flip-flop.
Who normally comes in to get this kind of thing? Is this going to be, I would think, you know, as we get older, everything gets a little bit thinner and skinnier kind of thing in terms of our hands and feet?
It's true. I mean, you would normally think that an older person would start to see some of that wasting away of some of those really soft tissues in the feet or the hands. But with the way people are taking selfies all the time of their feet and their hands, and they're trying to like really look as best as they can be in every kind of photo, we're seeing younger and younger people do this. And let me add that it is a preventative way, because a lot of times these things that we're injecting and also some of the peels and lasers that we do really prevent problems from happening, like skin cancers on the feet or on the hands, or just seeing that aged appearance to the hands. If you're taking off those old, dead, dried cells, you're going to have a very youthful look to the hands or the feet.
I like what you said. Now let me see what we've done so far. We just put a little bit right in here, right here. Right. But you said that it's reversible. So say it goes crazy and I'm like, I cannot stand the way that looks. What do you do to fix it?
Yeah, we always love that. You know, there's a antidote to this. So this is a hyaluronic acid, and we have something that's an anti-hyaluronic acid that we inject right into the area, and it basically washes it away. So if someone's looking at it and they go, you know what, I think maybe it's a little bit too much here, a little bit too much there, we can really take it away that way. And the same thing applies if we're putting it in the face and things like that. But once someone really sees it, my experience has been they love it, it lasts about a year, and then they want something more permanent. And that's when we would go to something maybe like a fat injection.
All right, Doc, I'm going to let you continue with this. Cara, you're holding up great. You look beautiful. So best of luck. She met somebody. Her mom's here. She met somebody. Can I say that? She's mortified.
She met somebody at the office?
In any event. So
what?
Not at the office. I'm not going to give away all her private business, but that's
intriguing.
Yes, back to you guys.
Hey, Karen, could you ever put her feet flat on the table there, or the bed, whatever the heck it is?
Yeah, let me show you. You want to say? Oh, he's doing it right now. Oh, hold on one stop.
Or just
come
have
back
her
and take a
scoot
look,
up
George.
and put her feet over the side.
Scoot up and put your feet flat down on the thing so we can
There
see
you
them.
go.
You know,
now, oh my goodness, I can see the tops of her feet. They're pretty feet to begin with.
I know. She doesn't need anything.
Aren't they pretty?
Yes.
Yeah.